So after the gray matter, let us talk about the white matter of the cerebral hemisphere. So guys, first of all, the white matter which is present in the cerebral hemisphere, we can broadly divide it into three types. So the white matter of the cerebral hemisphere is of three types. One, we have association fibers. We got association fibers. Number two, we have commissural fibers. Association, now we have these commissural fibers. And number three, we got projection fibers. Very, very important. That is projection fibers. So first, let's broadly understand what is the difference between the association, projection and the commissural fiber. Now, when you say association fiber, that means they are connecting different areas of the cerebral hemisphere, but in the same cerebrum only. I mean, you can say the fibers coming from the frontal lobe going into occipital, or maybe from the frontal to the temporal lobe. So we have like long association, short association, but they are connecting the areas of the same cerebral hemisphere. On the other hand, that is commissural fibers. Commissural fibers are those which are connecting the same areas in both cerebral hemisphere. Now you may see they're coming from this frontal lobe to this frontal lobe, or temporal to temporal lobe. And as we all know, the best example is the corpus callosum, the largest commissural fiber. Whereas the third type, that is projection fiber, are those which are projecting either up or projecting down. All the corticopital and corticofugal fibers, the one which are running toward the cortex and away from the cortex, will come into projection fibers. All the ascending tracts which are coming toward the cortex, all the descending tracts like pyramidal tract, that will come into what? Projection fibers. Internal capsule, corona radiata. So they are all examples of projection. So let's take them one by one, and no harm in writing a bit about them. As we said, association fibers are those which connects different areas of same cerebral hemisphere. They're connecting the different areas, but in the same cerebral hemisphere. Commissural fibers are those which connects same areas, at least functionally same, of both cerebral hemisphere. Whereas projection fibers are those which includes of all ascending and descending tracts. And when I say ascending and descending tracts, the one which are going toward the cortex and away from the cortex, right? Not the one which are in the brainstem, only in the brainstem. I mean, they should reach the cortex. So association, commissural and projection. So let's do one thing. Let us start with the association fibers first. Now guys, we divide the association fibers in two types. There are two types of association fiber. We have short association fibers. We got some short association fibers. And we have long association fibers. As the name suggests, short association fiber, please note they are also known as arcuate fasciculus. They're also known as arcuate fasciculus. The reason we call it arcuate fasciculus because they just need to make an arc and connect the neighboring areas. Now imagine if this is one gyrus here, then there is a sulcus, gyrus, sulcus. So these white matter bundle, look at this, the white matter bundle which are connecting the neighboring gyrus, they are the one which are called as short association fiber, or you can also call them arcuate fasciculus. They can just making an arc and connecting the neighboring areas. Whereas on the other hand, long association fibers can further be of several types. Like we have one, we got superior longitudinal fasciculus. We call it superior longitudinal fasciculus. Then similarly, there is inferior longitudinal fasciculus. We got fronto-occipital fasciculus. And the two very, very important, one of them is called as cingulum. It is also called as cingulate fasciculus or simply cingulum. And then we have another very, very important, that is uncinate fasciculus. Uncinate fasciculus. So these are the 5 types of long association fibers. That means they are traveling for a longer distance to connect the distant area in the same cerebral hemisphere. So let me use a schematic diagram here to show you that how exactly these fibers are connecting the distant areas. And even before that, I want to show you something, guys. Look at this: superior longitudinal fasciculus and fronto-occipital fasciculus. If you analyze the name of both these fibers, doesn't they both look like same only? I mean, superior longitudinal fasciculus will run from the frontal lobe to the occipital lobe and can go into the temporal lobe also, like this. And the same is done by the fronto-occipital fasciculus. They are also connecting the frontal lobe to occipital lobe, and some fiber can come to temporal lobe as well. So what is the difference? I mean, why do we have 2 different set of white matter bundle running in the same cerebral hemisphere when both of them have to connect more or less the same areas? Now understand it like this. Imagine in one cerebral hemisphere, if you have a continuous band of white matter running anterior-posteriorly like this, and there is no passage for the corona radiata, then how corona radiata will reach the top layer, that is in the cortex, into the gray matter? Corona radiata is a white matter and it also has to reach the cerebral cortex. So what will happen? The white matter bundle that you see in the cerebral hemisphere are divided in 2 parts. So one is the fronto-occipital fasciculus, one is superior longitudinal fasciculus, and the gap between the 2 is created, or you can say it is present, to give passage to the corona radiata only. To give passage to corona radiata. Imagine if this is the corona radiata, just a schematic diagram again. If this is the corona radiata, you can see it is radiating into the different areas of the cerebral hemisphere. So on one side, you will appreciate the superior longitudinal fasciculus like this. And on other side, it will be the fronto-occipital fasciculus. Let us say, just imagine if this is a superior longitudinal, and let's say this is the fronto-occipital fasciculus. This is corona radiata. Those are basically, they are separated by the corona radiata fibers. So these are the longitudinal fasciculus, that is superior longitudinal, and then we have the fronto-occipital fasciculus separated by corona radiata. Now what about other fibers, including these longitudinal fasciculus? And to represent them, if I again take a help of the medial surface of the cerebral hemisphere, although we have to see inside the white matter, but this is just a reference diagram. So as we already said, fronto-occipital fasciculus and superior longitudinal fasciculus. So let me draw it like this, and you will see if some fibers are running in this manner going toward the temporal lobe also. So this is including both. Let me use the numbers which I gave here. I gave number 1 and number 3 in my list. Number 1 and number 3, you can see number 1 is superior longitudinal, number 3 is fronto-occipital. So 1 and 3, superior longitudinal and fronto-occipital fasciculus. Then we got this inferior longitudinal fasciculus, which is connecting. Clearly, inferior longitudinal fasciculus will connect what? Temporal lobe to the occipital lobe. This is number 2 in our list, that is inferior longitudinal fasciculus connecting the temporal lobe to occipital lobe. But when it comes to question, the 2 which are very, very important are the cingulum and uncinate fasciculus. Now, first look at what is cingulum, guys. Cingulum word, I'm sure, reminds you of the cingulate gyrus, which we just discussed in the gray matter. Cingulum fibers are those which are running something like this around the corpus callosum and connecting all these important areas which are present in the circumference, or you can say in the periphery of the corpus callosum. So this here is number 4 in our list, that is cingulum. Let me write the name also here. That is cingulum. And why cingulum is important? Because as you can clearly see, it is connecting what? It is connecting those para-terminal, para-olfactory, cingulate gyrus, isthmus, para-hippocampal, uncus, all those parts which are the component of limbic system. So this white matter bundle basically is connecting the limbic lobe or the limbic system, and that is why cingulum is also called as, it is also known as limbic association fiber. It is also known as limbic association fibers, that is cingulum fibers. So this is the important one, the cingulum limbic association fiber. And then very lastly, we have uncinate fasciculus. Now, this may not be the right diagram to show the uncinate fasciculus. So again, we don't have to draw it very big. I mean, uncinate fasciculus, for that, it's better if I consider it from this diagram. Guys, uncinate fasciculus is the one which is actually winding around, or it is hooking around the sylvian sulcus. Now imagine if this is the uncinate fasciculus, that is number 5 in our list. This is uncinate fasciculus. And you can see what uncinate fasciculus is doing, because it is winding around the sylvian sulcus. So it is connecting all those important areas. Like, what is the important area? I hope you remember here. That is the Broca's area. What is the important area here? We have a sensory speech area, or the Wernicke's area. And here we got the auditory area. Look at this. All these important areas, they are connected by this white matter bundle, which is running around this sylvian sulcus. So if I just may write the numbers only, that is 44 and 45, that is for the Broca's. It is connecting 39 and 40, which is for the sensory or sensory speech area. And here we have area number 41, 42, and also encircling it is 22, which is a component of Wernicke's area. So all these important areas are connected by what? By the uncinate fasciculus, which is winding around the sylvian sulcus. So this is about the first category, that is association fiber. As we said, short association and long association fiber. And here in the diagram, you're looking at the long association fiber, which are mainly of 5 types: superior longitudinal, front occipital, inferior longitudinal, and the two very, very important, that is cingulum and uncinate fasciculus. So knowing about these association fiber, let us now talk about the second category, and the second category was of commissural fibers. So guys, the second thing that we will talk about here are the commissural fibers. Okay. Now, as we already said, that the best example for the commissural fiber is the corpus callosum. So obviously the largest commissural fiber, that is the corpus callosum. So we got this corpus callosum. Please understand one thing, that no matter how big corpus callosum is, it's a huge commissural fiber. But no matter how big corpus callosum is, it is still smaller than the cerebral hemisphere. If you look at corpus callosum, the most anterior part of corpus callosum is approximately 4 centimeters away from the frontal pole. And the most posterior part of corpus callosum is approximately 6 centimeters from the occipital pole. That means if the fibers are running transversely from the corpus callosum, first of all, they will not be able to connect everything in the two cerebrum if they're just running transversely. So we need to have, first of all, some kind of modification in the orientation of the corpus callosum fiber. So the fibers have to go forward also, and few fibers have to go backward also, and the fiber has to go downward also to connect the temporal lobes. Secondly, even after all these modifications, even the corpus callosum fibers, they run transversely and anterior, transversely and posterior, inferiorly as well. Still, they are not able to connect everything in the two cerebrum. So we have some small areas which are left, like olfactory lobes is left, like superior colliculus is left, habeneural nuclei is left, fornix is left. So all these smaller areas which are not connected by the corpus callosum are connected by some additional commissural fibers, which you see along with corpus callosum only. And those additional or extra commissural fiber which you will have are, one is the anterior commissure. We got the anterior commissure. We also have posterior commissure. Then there is habenular commissure. And we also have hippocampal commissure. Habenular and hippocampal commissure. So we're gonna take all these commissural fibers one by one. Well, the most important, let's talk about the corpus callosum first. So guys, corpus callosum, as we already said, first of all, it is the largest commissural fiber. It is the largest commissural fiber. And if you look at the parts of corpus callosum, now if you look at the parts of corpus callosum, you can divide the corpus callosum broadly in 4 parts. We have a portion called as a rostrum. I'll denote rostrum with R in the diagram. Then we got a part called as genu. Let's call it G for genu. Then we got a body, also called as a trunk. So the body or the trunk. And then the most posterior and the thickest part, that is the splenium of corpus callosum. S, let's say, is for the splenium. So we have these 4 parts, that is rostrum, genu, body and splenium. R, G, B and S. Okay, let me draw the corpus callosum to show you all these parts here. Let me just draw it on the side here itself. This is how broadly the corpus callosum will look like. Well, this here will be the rostrum. Well, rostrum should be the most rostral, as the name suggests. But it's not only that the cerebrum will bend during the development. The white matter bundle will also bend downward like this. And the rostrum is not the most anterior part. It actually turns downward and slightly backwards. So rostrum is not the most anterior part in corpus callosum. It's actually this bend. The genu is the most anterior part. And then we have this body here. The major part here is the body. And the posterior and the thickest part, this is the splenium of the corpus callosum. So these are the 4 parts. We got a rostrum. Then we have the anterior most part, that is genu. Body and the posterior part is the splenium. When you take a section for the corpus callosum, now it is quite evident because we are talking about the commissural fibers. So they're running from one cerebrum to another cerebrum. So you take one sagittal section and you should be able to appreciate other commissural fibers also, because they're all running transversely. So guys, let me again take a section of the corpus callosum, but this time we will also be appreciating other commissural fibers like anterior, posterior, habenular and hippocampal commissure. And then we will see what exactly their function is. So there we go. This here again is the corpus callosum. Now just below the genu rostrum of the corpus callosum, you will see a band of the commissural fiber, and that is nothing but the anterior commissure. Let me write that in short. That is anterior commissure. This is the anterior commissure. The location is very important, that where are they? So anterior commissure is just below the rostrum of the corpus callosum. If you look at this posterior part, below the splenium of the corpus callosum, you will appreciate pineal gland. And this pineal gland will have 2 lamina. There will be a superior lamina of the pineal gland, and we have this inferior lamina of the pineal gland. This here is the superior lamina, and this one here is the inferior lamina of this pineal gland. So let me write this gland first. This is the pineal gland. That's a pineal gland. And you can appreciate a commissural fiber which is present in the superior lamina, a commissural fiber present in the inferior lamina. The one which is in the superior lamina, this here is the habenular commissure. This is the habenular commissure. Remember where it is? It is in the superior lamina of the pineal gland. And the one that you see in the inferior lamina is the posterior commissure, which I would say, out of all the commissural fiber, this is the most important from the exam point of view. That is the posterior commissure. Apart from corpus callosum, of course. That is posterior commissure. Hippocampal commissure is a bit difficult to appreciate in this picture because hippocampal commissure is connecting the 2 fornix. Guys, fornix is one part of the cerebrum which none of us saw very clearly in the first year dissection or in the textbook. Fornix are oriented in such a way, these are the white matter bundle which are oriented in such a way that they start on the posterior lateral aspect and then they turn anteriorly and then goes into the mammillary body. So the orientation of fornix is something like this. So no matter where you take a section from, whenever you take a section of the fornix, you will see just a piece of fornix. It's not easy to see the entire fornix at once. You have to remove so many structures around it. So both the fornix, the columns of the fornix, they come very, very close to each other. And when these columns of fornix come too close to each other, they are connected by a thin sheet of white matter, and that is called as what? Hippocampal commissure. It is also called as the commissure of the columns of fornix or hippocampal commissure. Now, let us say if this is a site for the fornix, so this has to be the site for the hippocampal commissure also. So somewhere here, let's say this is the site for the hippocampal commissure. Just a representation here. That is hippocampal commissure. So apart from the corpus callosum, these are the 4 other commissural fiber you should know about. Let us talk a bit more about them one by one, that what exactly they are connecting. I said anterior commissure, guys. What anterior commissure will connect? Anterior commissure will connect the most anterior and inferior part of temporal lobes. Temporal lobes. Major chunk of the temporal lobe are connected by corpus callosum only. But the most anterior, if you look at the temporal lobe, the most anterior part of temporal lobe and the inferior part of temporal lobe is connected by the anterior commissure, which also includes the olfactory areas. Including olfactory lobe. That's what anterior commissure is doing. As I said, corpus callosum is not able to connect everything, and that is why we have some commissural fibers. Anterior commissure is connecting the most anterior and the inferior part of temporal lobe, including the olfactory lobe or the olfactory gyre. Remember that uncus part? That is the primary olfactory area. Similarly, posterior commissure on the other hand, and let me take these first. Hippocampal commissure, we just said it connects fornix, or you can say it connects the columns of the fornix. I'll tell you a bit more about this hippocampal commissure in a minute. Habenular commissure, well, the name suggests habenular commissure connects the habenular nuclei. It connects the habenular nuclei, the nuclei of the diencephalon, the habenular nuclei. And then we got a posterior commissure. See what posterior commissure will be connecting. Just first understand that what is the location of posterior commissure. Posterior commissure is in the inferior lamina of the pineal gland. And when you say the inferior lamina of the pineal gland, you have to think somewhere close to the upper part of the midbrain. It is like very cranial part of the midbrain, because when you saw the 2 superior and the inferior colliculus of the midbrain, in between the colliculus of the midbrain, you can see the pineal gland extending. So this posterior commissure is very close to the rostral or the topmost part of the midbrain here. And think about visual reflexes. Now, what are the nucleus which are responsible for the visual or the ocular reflexes? It is superior colliculus itself. There is a nucleus called as pretectal nucleus. And we also have a nucleus called as the accessory oculomotor nucleus or interstitial nucleus of Cahal, which we talked about in the MLF, medial longitudinal fasciculus, that interstitial nucleus of Cahal. So both the side nuclei are connected by this posterior commissure. It connects to superior colliculus, pretectal nucleus. The word tectum is for the midbrain. The pretectal nucleus, and also the accessory oculomotor nucleus. Let me remind its other name, which is also called as interstitial nucleus of Cahal, which is also called as interstitial nucleus of Cahal. So this is what is done by the commissural fiber apart from the corpus callosum. These are the fibers which are additional to corpus callosum. Now, as I said, I'll tell you a bit more about this hippocampal commissure. It's very important. I've seen the questions asked not directly on the hippocampal commissure, but the question which are roundabout on the hippocampal commissure itself. Now, what those questions are, let me just tell you that question first. Now, in the recent AIMS only, what they did, they gave a coronal section of the cerebral hemisphere. Now, when they give you the coronal section of the cerebral hemisphere, we expect to see the fornix like this. The fornix is running like posterior anterior, like this. This is how the fornix are running. So when you take a coronal section, so you will see the fornix like 2 dots only. and they are present below the septum pellucidum, which I'll show you eventually in the section. So the question was on those fornix, the arrow was marked, but the question was that the following fibers, that means the arrow was on that, the following fibers on which the arrow is marked begins where? In the cerebral hemisphere. That means you should first need to identify that what those fibers are. Those are fornix, which, as I said, we will identify in the mother section. And you should also know that where the fornix will begin and where it ends. So for that, I'm using this diagram, although this is a view from the top, guys. Let us say you're seeing the cerebral hemisphere from the top. If you see it from above, now how this thing is going to look like? Okay, if let us say these are the two mammillary bodies. This is the mammillary bodies. Here we got the fornix, which is connected to the mammillary body. And then you will see these the columns of the fornix, which is going backwards and downwards. So what do you see here? If let's say this green color here represents the fornix, if these are the columns of the fornix here, we said the fornix are connected by this thin sheet of white matter that is called as hippocampal commissure. I'm just, let's say, using this red color for the hippocampal commissure. This is the hippocampal commissure. This here is the hippocampus. And that's what the question was. The question was the fornix fibers, which were marked and not, the name was not suggested. The hippocampus, the fornix fiber will begin where? So you can see the fornix fibers are actually starting from the hippocampus and they're terminating in the mammillary body. It's not the other way around. So no harm in drawing these arrows so that you remember that the hippocampus, this fornix fibers are actually originating from the hippocampus and then they will go and terminate into the mammillary body. So origin is in the hippocampus and the end in the mammillary body if the question is asked on this hippocampal commissure connecting the columns of the fornix. So this is about the 5 types of commissural fiber including corpus callosum. But guys, coming back to the corpus callosum again, we said corpus callosum needs to have some sort of variation in its fiber or the modification in its fiber to connect the different areas of the cerebrum. So let us understand what corpus callosum will do so that it will be able to connect majority of the part of the two cerebral hemisphere. So for that, I'm going to take one transverse section of the cerebral hemisphere here. So I wanted to draw this with me. That is transverse section. Now, when you take a transverse section, first of all, obviously you will expect to see the corpus callosum itself. This is the let us say corpus callosum part. What is the most anterior part of corpus callosum in the transverse section? That is genu. And the most posterior part would be splenium. And then we have these two cerebral hemisphere. Let us say there is a right cerebral hemisphere or the left, and this is the opposite cerebral hemisphere. Please take your time and draw it with me. This is the corpus callosum, the transverse section through corpus callosum. And as you can see, the genu of the corpus callosum is still, or as I said, almost 4 cm from the frontal pole, and the splenium will be around 6 cm from the occipital pole. Now, as I said, moreover, when you take a transverse section, let's say this transverse section is taken in such a way that you can see the horns of the ventricle. Look at this, guys. This is how the lateral ventricle was. I mean, I'm not drawing the entire thing. If this is how the ventricle is, and imagine if I take a transverse section from the cerebral hemisphere, so I expect my transverse section to go like this. That means the section will go from the anterior horn and also from the posterior horn, and not from the body and the inferior horn. So we are taking a section in such a way that the inferior horn will be marked and the posterior horn will also be seen here, and especially the posterior horn, which I am more concerned about here. So let us say this is the posterior horn of the lateral ventricle. That is a posterior horn of the lateral ventricle, which you can see here. And here we have the anterior horn. Let us say these are the anterior horn. I'm just writing in short, that is the anterior horn, and this here is the posterior horn of the lateral ventricle in the transverse section. Coming back to our point, we said the fibers in the corpus callosum, yes, they are running transversely. They are connecting the cerebral hemisphere. They will be able to connect the parietal lobe and temporal lobe. But what about the frontal lobe and occipital lobe? And for that, what fibers have to do? The fibers which are coming from the genu of the corpus callosum, they need to go forward as well, like this. And once they will go forward, then only they will be able to connect the frontal lobe. And because these fibers are bent like a forceps anteriorly, so these fibers are called as forceps minor fiber. These are the forceps minor fiber. Yeah, that's a part of corpus callosum only. These are the fibers from corpus callosum, but we've given them a special name because they are moving forward and connecting the frontal lobe, so we call them forceps minor. Similarly, fibers from the genu of the corpus callosum will run backward, adherent to the posterior horn of the lateral ventricle. They are running backward and obviously on the medial side, and they are adherent to the posterior horn of the lateral ventricle. So first of all, what these fibers are called as, these fibers are longer because they have to travel almost 6 centimeters to reach the occipital pole. So these are called as forceps major fiber. These are forceps major fiber. Those are minor and these are forceps major fibers, part of corpus callosum. The very important thing to note here that when these forceps major fibers are running backward, and when they're sweeping backward, they also produce an elevation in the medial wall of posterior horn. Look at that. They will also produce an elevation in the medial wall of posterior horn, which I'll show you in the real-time section after this. And this elevation in the medial wall of the posterior horn is called as the bulb of posterior horn. So that is a question also. Bulb of posterior horn, which is the elevation on where? On the medial wall of posterior horn, is because of what only? It is because of the forceps major fiber. So when the forceps major fibers sweep backward, they produce this elevation called as the bulb of posterior horn. Now the fibers which are coming from the splenium and from the body, some fibers obviously are running transversely, like this transversely running fibers also from the body part. And from the splenium, you will also see the fiber which are sweeping backward as well. Look at this. The fibers which are sweeping backwards also. And this time I'm looking at the fibers which are lateral to the posterior horn. Let me just draw it on one side only. So these are again the fibers coming from the splenium. Again, these are the fibers of corpus callosum only. You can see few are running transversely, which are coming from the body, and few are running backwards and lateral to posterior horn. These fibers are called as, collectively we call them tapetum fibers. We call them tapetum fibers, which again is a part of corpus callosum. So be it forceps major, forceps minor or tapetum, they are all components of the different type of fibers that you see coming out of the corpus callosum. But remember, tapetum is lateral to posterior horn, and this one. And see, tapetum is not only lateral, tapetum is going on the roof of the posterior horn and then coming to the lateral side. So tapetum is having two relations to the posterior horn. It is on the roof and then going on the lateral side. In this transverse section, you can only see the lateral. You cannot see the roof. So it is in the roof and the lateral side. What exactly the tapetum fibers are? You know, when you look at the section of the corpus, this cerebral hemisphere, you will not only see the commissural fibers which are running transversely, you will also see the projection fibers which are running vertically. Transversely and vertically. And that's why these fibers at certain places will be intermingling with each other, and that portion will look a bit granular because of these longitudinal running fiber, or you can say the internal capsule fiber. Tapetum are those fibers coming from the corpus callosum which are not intersected by the corona radiata. Corona radiata, or you can say the internal capsule, in the lower part, that is internal capsule only. I mean, let's imagine if this is the internal capsule, just drawing on one side, will tell you a bit more about it in detail. Let us say if this is internal capsule. As we know, internal capsule is a type of what fiber? Internal capsule is a type of a projection fiber. So internal capsule will be running vertically, corpus callosum running transversely. So what you see regarding the tapetum fibers, that there are the fibers which are running transversely, they're running downwards also, they're running backwards also, but they're not intersected by the internal capsule. You can see they are not intersected by the internal capsule, so they look more whitish in appearance. And because of this more whitish and the shiny appearance of this tapetum in a fresh section of the cerebral hemisphere, the name given to them is tapetum. They are lightning white. That is called as a tapetum. So this is about the forceps minor, the forceps major, the tapetum fibers, and why we call them tapetum, because they are the one which are not intersected by internal capsule or corona radiata. We can use this section to also understand that what else apart from this we can see in the transverse section. Now, obviously, our topic right now we're discussing is corpus callosum, but in between the topic itself, let us also find out that when you take a transverse section of the cerebral hemisphere, what are the structures that you should be able to identify, whether it is a cut section given in the exam, or if it is a section, it's MRI or the CT images given for the brain, you can still able to identify them. So guys, what I'm going to do is, I'm going to take only this part separately in a bit more of detail, and let's find out what other things we have in between this corpus callosum and the internal capsule. So let me just take this middle part of this picture separately. So I'm continuing with the transverse section itself again. So there we go. This is the corpus callosum. Let's go in a very schematic way. This is the corpus callosum. Here we got the internal capsule. We'll try to use a common color for the white matter and gray matter. So obviously both are white matter only. Corpus callosum is a white matter. I'm using the same color for the corpus callosum and for the internal capsule. It will be a bit easier for us to, it will be more soothing to eye when we use the same color for the white and the gray matter. I'll label everything at the end. I want you to please draw it with me. Then what you'll see between this corpus callosum and internal capsule, we have the head of the caudate nucleus, and you can also appreciate thalamus in this part, which we will discuss separately in detail also. And laterally, here will be a lens shaped nucleus called as lentiform nucleus will be seen on the lateral side. This here is the caudate nucleus. This here is the thalamus. So you can see the caudate nucleus and thalamus which are sandwiched between the corpus callosum and internal capsule. And then laterally what you see, this is the lentiform nucleus. It's the lentiform nucleus which is present more laterally. Again, I'm using the same color for the gray matter. These are the gray matter thing. You will also see another piece of a thin gray matter which is lateral to lentiform nucleus, for which the function is not very well known. That is called as the claustrum. Again, let me use the same color for that. This is the claustrum. So what you see between this claustrum and this lentiform nucleus, we again have this white matter here. There is again not very thick, but we have this thin piece of, a thin slice of white matter in between. And most laterally in this section, you will appreciate the hidden lobe. What is the hidden lobe, guys? The hidden lobe is the insula. So let us say this here is the insular cortex or the hidden cortex. That's how the hidden cortex would be. And when I say cortex, hidden cortex, again I'm talking about what? The gray matter. So this is the insular cortex, the one which I'm highlighting here. That is a hidden cortex. Until and unless you open the sylvian sulcus, you cannot see it. It is hidden inside the sylvian sulcus. And lastly, there's another piece of white matter that you will appreciate between the claustrum and this hidden lobe called as insula. So there we go. Let me label this for you now. So guys, we said starting from the medial most, this here is the corpus callosum. This here is the corpus callosum. We got this caudate nucleus. More precisely, it's the head of the caudate nucleus. This, of course, is the thalamus. This white matter bundle here is the internal capsule, which we will talk about in a minute. That is internal capsule, very important. Another gray matter that you see, which is outside the internal capsule, I should mark this one first. Lateral to the internal capsule, this is the lentiform nucleus. Lentiform nucleus. Then lateral to lentiform nucleus, I'm just taking the gray matter first. This is the claustrum. This portion is claustrum. And lateral to the claustrum, that is the most lateral structure, the hidden lobe, that is called as the insula. Insula, which is also called as island of Riehl. It is also called as the island of Riehl. What also is important here, and before I label those two things, see, have you ever wondered why we call it internal capsule? What is the word capsule here is for? I mean, it's a white matter bundle, but we are using the word capsule for it. Well, the reason for calling it capsule is because they're capsulating the basal ganglia. This is lentiform nucleus, that is basal ganglia, right? Or the basal nuclei. So when you see the white matter bundle, which is inside the basal ganglia, that is internally covering it. So we call it internal capsule. Therefore, the white matter that you see here, this one, is called as external capsule because it is covering the basal ganglia from outside. That is called as external capsule. And then finally we have another piece of the white matter which is outside the claustrum, and that is why we have to call it extreme capsule. That is the extreme capsule. So guys, these are the things that you should be able to identify, whether it is an image-based question or it is if the MRI is given. Claustrum you will not be able to appreciate radiologically, but the rest other things you can, including all these internal capsule, lentiform, caudate nucleus, you can very well appreciate them in the MRI or in the section, cut section, which is given in the exam. So if I just have a quick recap on what we saw in the transfer section, and then I'll show you one real-time section in which we will try to identify them. So guys, first we said we saw the corpus callosum, and we can see the forceps major fiber, we can see forceps minor fiber and major fiber. Forceps major fibers were sweeping backward and producing the elevation in the medial wall of posterior horn. That is called as what? Bulb of posterior horn. We also have the fibers coming from the corpus callosum and going backwards and laterally, and that is lateral to what? Lateral to posterior horn. Those fibers were tapetum fibers, not intersected by the corona radiata or internal capsule. And then we saw certain other structures which are between the corpus callosum and outside, that is insula. So many things in between the two. We have this caudate nucleus, thalamus, we got internal capsule, we got basal ganglia, we got lentiform nucleus, external capsule, then we have claustrum, then extreme capsule. So all these things you should be able to identify in the transverse section. Let me show you one comparative image which will make it more clear. So guys, here's the section I was talking about. This is the transverse section of the left side, and you're only seeing one half here so that we can clearly see these structures. Okay, now presuming that this is a site for the corpus callosum, now we said the fibers which are coming from the genu of the corpus callosum and going forward, this has to be the forceps minor fiber, right? That is forceps minor fibers. And this is got to be the forceps major fiber. Look at that. They are going to the medial side of the posterior horn, that is forceps major. And what you can appreciate, because of this forceps major, this elevation in the medial wall of the posterior horn, that is what? That is the bulb of posterior horn. You can see the choroid plexus also inside. Just don't bother about it right now. And if you look at the lateral side, if you see the lateral to the posterior horn, these white matter bundle, that is what we call as the tapetum fibers. That's the tapetum fibers. So we got a forceps major, that is a bulb of posterior horn. This here is a tapetum. Let's come into the middle part. Now when you come into the middle region here, you can clearly appreciate this internal capsule. Look at the one I'm highlighting here. That is the internal capsule with the genu or the bent of the internal capsule, right? And if that is the internal capsule, then obviously this here is the caudate nucleus, the one which I'm putting a dotted line around, that is the caudate nucleus. If that is a caudate nucleus, this here is the thalamus. Look at the area I'm highlighting here. This is the thalamus here. Of course, lateral to thalamus, this is going to be the lentiform nucleus. This here is the lentiform nucleus. And if I bring you up close, look at this. This we already said this is internal capsule. If I bring you up close, I hope you can all appreciate this very thin sheet of gray matter. Can you see that? That over there is what? This is the claustrum. This gray matter here is the claustrum. That is claustrum. And medial to claustrum and lateral to claustrum, you can see the white matter. That is the external capsule and extreme capsule. This is the external capsule. And the one which is outside this here is the extreme capsule. And that is the extreme capsule. And of course, this lateralmost here, this hidden gyrus here, this is what is the insula. This is the insular part. The insular cortex or the island of Rheel. So as I said in the transfer section, these are the structures which are must. You should be able to identify all of them. The forces minor, major, bulb, tapetum, internal capsule, relations of internal capsule, and more laterally, that is claustrum and all those insula and external and extreme capsule. So I hope this clarifies this transfer section for you guys.